Today we are covering stroke, one of the most time-sensitive emergencies you will encounter as an EMT. A stroke is a sudden interruption of blood flow to part of the brain. When brain tissue does not receive oxygen and glucose, cells begin to die within minutes. Remember this phrase, time is brain. The faster we recognize stroke and initiate care, the better the patient's outcome. So what is a stroke? A stroke occurs when the blood flow to the brain is either blocked or bleeding. There are two primary types, ischemic stroke and hemorrhagic stroke. Ischemic stroke, this is the most common type. It occurs when a clot blocks blood flow in the cerebral artery. Clots may form locally or travel from another area, such as the heart in patients with atrial fibrillation. Hemorrhagic stroke, this occurs when blood vessels rupture, causing bleeding into or around the brain. Bleeding increases pressure inside the skull and damages brain tissue. You may also hear the term TIA, transient ischemic attack. A TIA is a temporary blockage with stroke-like symptoms that resolve on their own. Even though the symptoms go away, a TIA is a warning sign of a possible major stroke. So let's apply this. You are dispatched to a private residence for a person not acting right. You arrive to find a 68-year-old female sitting at the kitchen table. Her husband says she was fine 30 minutes ago while watching television. He says she suddenly dropped her coffee cup and began speaking strangely. You introduced yourself and began your assessment. You notice right-sided facial droop, slurred speech, weakness in the right arm. She cannot hold her right arm up when asked. She appears confused. Her vital signs, blood pressure is 198/104. Heart rate is 88 regular. Respiration is 18. Her SpO2 is 96% on room air. Blood glucose is 112. Now ask yourself, what is it? Is this hypoglycemia? Is this a seizure? Is this intoxication? Is this a stroke? Symptoms were sudden. They're unilateral. Blood glucose is normal. There's a facial droop, arm drift, and speech abnormality. This patient is experiencing a probable acute stroke. Next question, what time was she last known well? Her husband states she was normal 30 minutes ago. That time is critical. It must be clearly documented and communicated to the hospital. So what do? You should manage the airway if needed, administer oxygen if hypoxemic, keep the patient NPO or nothing by mouth, elevate the head if tolerated, perform a stroke scale, rapidly transport to a stroke-capable facility. Provide early hospital notification. This is how you save brain tissue. Some of the risk factors of strokes include hypertension, being the number one risk factor, diabetes, smoking, high cholesterol, obesity, atrial fibrillation, a previous stroke or TIA, advanced age. So let's think about the pathophysiology behind the stroke. The brain requires a constant supply of oxygen and glucose. It has no significant storage capacity. When perfusion stops, brain cells switch to anaerobic metabolism. Lactic acid builds up, cellular swelling occurs, cells begin to die. Permanent damage can be in as little as 4 to 6 minutes. With ischemic stroke, there is an area of infarction surrounded by penumbrum, tissue that is injured but potentially salvageable. Your job is to protect that penumbrum through rapid recognition and transport. Some of the signs and symptoms we'll see. So stroke symptoms are typically sudden in onset. Think be fast. Balance problems, eye changes, facial droop, arm weakness, speech difficulty, and time to call for help. Other findings may include unilateral numbness, severe sudden headache, difficulty swallowing, decreased level of consciousness, vision loss. Assessment priorities. Your priorities include scene safety, your primary assessments, airway, breathing, and circulation. Oxygenation and ventilation as needed. Rapid neurologic assessment. Determine last known well time. Check blood glucose. Use a validated stroke scale, such as the Cincinnati Pre-Hospital Stroke Scale. Minimize scene time. Management at the EMT level is support airway, support breathing, support oxygenation. Provide oxygen if indicated, assist ventilations if indicated, position the head elevated if tolerated. Do not give food or drink. Do not aggressively lower blood pressure, and rapid transport. Early hospital notification is crucial. Some of the key takeaways. Stroke is a neurological emergency. Sudden onset, unilateral deficits, abnormal speech, normal glucose, time matters. You cannot reverse a stroke in the field, but your speed, assessment, and communication can determine whether brain tissue lives or dies. Time is brain.